Welcome, everyone, to part 3 of this dental debacle that I'm faced with. Some people were saying they can't wait for part 3. There's going to be a part 3. I was hoping there wouldn't be a part 3, but there is. It's a rant video. Happened today. I'm going to talk about it. I hope you saw my other 2 videos. If not, I'll try to link them in the corners here. The pictures of them at the end of this video you can just click on. All right, here's the deal. When we last entered this soap opera thing and we finished it off, the last chapter of a cliffhanger, I was going to the oral surgeon, Dr. B, who I've seen before and who I trust, and he was going to take care of this matter for me. He was going to do free x-rays. I was going to get free x-rays, and he was going to assess the problem and see what he recommends. Well, I went there, and Dr. B, sure enough, took an x-ray again, and the x-ray was free, no charge for the x-rays, just as said. And also, I was pleasantly surprised, at least up to this point, there was no consultation fee. I was told it would be $120 consultation fee. I didn't get charged anything. Whether I'm going to be, but they usually want you to pay up front here. So whether it was courtesy or not, I don't know. Whether I'm going to be billed later or not, I don't know. But that was good. And yeah, he looked at the x-rays, and just like if you remember the saga, dental lady who did me wrong, he pretty much, at least visually, I said in the last videos, x-rays don't lie. I mean, the x-rays show way back here, the last molar, there's an infection under there, and in front of it, I've got an old crown that's 30-something years old, and for some reason, there's an infection under there too, and I could see it. So both of those either have to get extracted, or I got to get implants, or I got to get a bridge, all this kind of stuff. And so far, I haven't had anything done, but my decision is to get them extracted. When I'm going to get them extracted, I'm going to get them extracted sooner rather than later. But as I make this video, Thanksgiving is in a couple of days. The holidays are here. I'm going to be traveling for Christmas. I really don't want to have 2 teeth pulled, possibly if there's any complications, and knowing me, there could be. I don't want to bog down the holidays with this problem. I'd rather wait till right after the new year. So if I can put this problem off a bit and still be kind of pain-free, although this pain comes and goes. Sometimes it's very intense, and sometimes I'm good for 5 days. I'll do that. Well, anyway, so this guy who's very good, he said he would prescribe an antibiotic for me. You know, at least that's one thing up from the dental lady. Dental lady let me leave her office with infection and pain and no treatment or no antibiotic, no nothing. So at least he prescribed a medication, that medication being doxycycline. I'm not pronouncing it right. It's an antibiotic, but I've had this before for upper respiratory infections, and I don't want to go through my whole life story here, but I have certain reactions to, like clindamycin, I had a negative reaction to once, so we don't take that. So I suggested, is doxycycline okay? And he said, oh yeah, we could use that if you could tolerate that. And I said, okay. So this was yesterday. Yesterday at 4 p.m., he was going to call this in. Well, this morning I call up the pharmacy to see if the medication's ready, and they say they've not received any medication prescription. They haven't ever received it. Here we go. These are what the Rant videos are about. The, incompetence and the forgetfulness of the mess that is the 21st century all the time. It's not just this time, it's anywhere, anytime, whether you're going to the doctor, whether you're ordering something online, whether you go to the bank. It's everywhere. It's just incompetence and mistakes, insurance companies, and on and on and on. So anyway, okay. So I call Dr. B's office first thing in the morning today, and I say, listen, I said, there's no prescription. They didn't receive one. Maybe you sent it to the wrong pharmacy or something. And remember the good old days? You go in there, the doctor says you need a prescription, so he writes a prescription and hands you the prescription right there, and you go to your pharmacy. No, now they do it online, or they call it in, and sometimes people don't get it. They get their wires crossed. So anyway, the receptionist at Dr. B's says, okay, we'll send it again. Now, I don't really know if that was an honest mistake, or maybe they forgot. Whatever. We'll send it again. Second time, they send it again. And it's good. And I call up the pharmacy to make sure they got it. They say, yeah, we have a prescription, the pharmacist tells me, for you here. Doxycycline, he says it's a 1 month supply. 20 milligrams twice a day. I'm saying, whoa, 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 whoa. Personally, I've never taken an antibiotic for 30 days. I don't want to take an antibiotic for 30 days. Right away, I get on the computer, the laptop, and I start typing. I start seeing like possible, dangers of taking it 30 days. And I'm like, look, as far as I know, you only take an antibiotic my whole life for like a week to 10 days, maybe 2 weeks, but never a month. What's up with that? I also find out that my insurance is not going to cover the cost of the 20 milligrams. It's 20 milligrams twice a day of doxycycline. And usually my insurance company is fine with covering doxycycline, at least when it's a regular prescription, not 20 milligrams. This seems to be a different dose, a different strength they're not covering. So I get back on the phone. I have some questions. I have a lot of questions. So I get back on the phone again with the receptionist from Dr. B's office. And I tell her my concerns. I say, listen, I'm trying to be nice because I don't want to have any kind of like apple cart upset. I say, I never had taken an antibiotic for 30 days. What's the story with this? She says, well, you're going to take it twice a day for 30 days and 20 milligrams. I said, yeah, but it sounds like, she says, oh, hold on a minute. So she puts me on hold for a second. Maybe she's consulting with Dr. B. I don't know. She comes back. She says, oh, it was a mistake. That was a mistake. So you called in the wrong thing. You're supposed to take the doxycycline 7 days. I guess maybe, I don't know if it was 100 milligrams. Don't quote me on that. Don't hold me to that. I haven't picked it up yet. But the biggest strength for 7 days. No, that. And I said, well, that seems more like it, So I also said, listen, the doctor didn't say anything about when I get the teeth pulled, do I have to wait do I have to take all the pills? Do I have to wait till this clears up, the infection? Do I have to and she says, no, you could come anytime. You can come. You want me to make an appointment now? You can come in tomorrow, the day after. I said, oh, it's like, wait a minute. It's like nobody told me anything. It's like, so I had to ask, could I find out, please, the situation if I have to wait till it clears up before we do the extraction? She said, hold on. So she goes back and gets back to me, texts with the doctor. No, you don't have to wait that long. You can come just about any time you feel comfortable. And I'm thinking to myself, then why the hell am I taking the antibiotic anyway? Yeah, I don't blame Dr. B because I like the guy and he's good, but it's everywhere, man. Nobody's together on any of this. Anyway, I didn't tell you another part. I want to end with this because this is important. Dr. B also recommends, and you've heard this before, some of you have had dental issues, bone grafting. Let's talk about bone grafting a little bit. After they extract teeth, in order to keep it strong, the bone, and keep it rigid and everything, and able to get an implant, I have no intention of getting implants back here or half dentures. He suggests I could get a partial denture just for the back. I don't think I'm going to do that. But anyway, the idea is, and I've heard of this before, he's pushed this before, a bone graft. And, the bone grafts are not cheap. One for each tooth that he's going to take out of here. And I've been doing all kinds of research for overnight, and I'm trying to figure out, is it good to have a bone graft or not? What I'm hearing is, as I said, if you're going to get an implant, it's good to get a bone graft. I'm not getting an implant. But also, if you don't get an implant down the line, it's supposedly good because it will keep your facial structure normal. And there's also the matter of sometimes you might have teeth that later on will shift, and I'm worried about that. I've had back teeth extracted, one down here, a couple up here. Everything's good in the front, but the back. So the question is, do I want to do a bone graft, and should I do a bone graft? I've looked up everything. People experts that say it's good to do it. People say you don't need it. The thing is, I don't want any complications down the line. I'd like to ask you people out there, anybody out there who's had experience with this, extractions and so forth, do you think it's really pretty damn good idea to get that bone graft? Or if you have somebody especially that's had the teeth pulled and you haven't had any shifting and you haven't had any problems for like 20 years, 10, 15 years, don't worry about it. I'd like to know what you think. Is this the end of this? I don't know. Is this the last chapter? I don't know. All I can tell you is I'll take it as it comes. I don't know when I'm going to make the appointment. I could make it for a week from now, 2 weeks from now, to get these extracted before the holiday. But I just feel like I'd like to get through the holiday first and attack that in early January. Opinions welcome. Thank you.